Well, thank you, Mr. Chairman, and thank you to all our witnesses for being here today. American people and more than 750,000 Kansans gave President Trump a mandate to bring major changes to Washington. His Department of Government Efficiency identified unprecedented levels of waste, fraud, and abuse within the federal government, sometimes to the tune of tens of billions of dollars. House Republicans, one big beautiful bill, removes waste, fraud, and abuse within Medicaid and the SNAP food stamp program, empowers able-bodied adults to work, and more importantly, puts American families like the ones I represent in Kansas first. We owe it to current and future generations of Americans to strengthen our federal programs so that those who truly need benefits can receive them. This should not be controversial. It's how the programs were originally intended to work. Improper payments in Medicaid have consequences. These misspent dollars could have gone to Americans who need health insurance coverage. Since 2015, an estimated $542 billion have been improperly paid in Medicaid. That's enough to cover the health insurance of 6.3 million people, more than twice the entire population of the state of Kansas. The common sense reforms that my colleagues and I have put into the One Big Beautiful Bill will benefit the American people and our program beneficiaries. Mr. Dickerson, in 2024, the USDA reported an average national payment error rate of 11.7%. This rate nearly doubled since 2019. Some of our colleagues have tried to downplay the severity of this problem. What do you think it's so important to address, and how will the reforms in H.R. 1, the One Big Beautiful Bill, help reduce and prevent improper and fraudulent SNAP food stamp payments?
Yeah, that's right. And we know actually the number is actually much higher because USDA has been instructed in the 2014 Farm Bill to ignore certain improper payments. And it's completely unjust for exactly the reason you laid out, because it's taking money away from people who shouldn't, who should be getting those benefits, and taxpayers who have better uses for that money rather than going to waste, fraud, and abuse. The One Big Beautiful Bill does take important steps, right? It actually gets rid of the provision that says don't count the money. And then importantly, it gives states skin in the game for the first time to try to administer their programs correctly.
Well, thank you. Mr. Staley, your op-ed touched on the importance of work requirements in Medicaid, as well as, your testimony today was really touching in terms of talking about how you and your family are personally impacted, and your son. Can you share more about how Medicaid work requirements for able-bodied can help benefit America's most vulnerable?
Sure. Thank you. Thank you for that question. So ultimately, by freeing up these resources, states will have the ability to pay down the waiting lists, and they can start to direct more of that money that they would be spending on able-bodied adults on people like my son who are languishing on these waiting lists. And we know that from FOIAs just in a handful of states where they reply, we know that 39,000 people have died while waiting on these waivers on the waiting list. So ultimately, this has been talked about, but work is transformative and there's dignity in work. And so it's not just helping people like my son. It's not just helping truly needy, truly vulnerable, but it's also just good for all of us, because when people move out of dependency and move into work, that's when they can start to fulfill the American dream.
Yeah, well, thank you. You pointed out what's true in my home state of Kansas. Our state legislature has resisted the expansion of Medicaid because we have a waiting list for the disabled and the less than 100% of poverty level. And we think those individuals ought to be treated first and allowed to be enrolled and receive those benefits before able-bodied adults are entitled to those benefits. Mr. Lays, I'm going to ask you kind of an open-ended question here, is whether you can answer whether it deals with waste, fraud, and abuse or work requirements or whatever. It's just, how can the One Big Beautiful Bill that the Republicans are promoting help strengthen the Medicaid programs and ensure that it exists for years to come?
So first, checking eligibility. The big problem with improper payments is that the Biden administration just made it more difficult to remove people that weren't eligible for the program, and so it would do more frequent eligibility reviews for the able-bodied population, which is really important when the cost of that population is almost entirely borne by the federal government. States have really bad incentives around the expansion because of the economics. So just checking eligibility is a big piece of that, and then putting in place the work and community engagement requirement.
Yeah, thank you. And I think it highlights in general, just every dollar we save through waste, fraud, and abuse is a dollar that can go to the benefits of those people that really need it. With that, Mr. Chairman, I yield back.
I thank the gentleman from Kansas and now yield.